on the final lecture of the day, and then which will be followed by a couple of panels. We're privileged to bring you our next speaker, Sam Berne, OD. He will be talking on The Eyes Never Lie, What Your Vision Reveals About Your Health. Dr. Berne, a few words about him. Dr. Berne received a Bachelor of Science from Penn State University, a doctorate from the Pennsylvania College of Optometry, and a postdoctoral advanced degree from the Gesell Institute in Child Development. Aside from having a private practice, he's done clinical research, been a faculty member at the Gesell Institute, and authored 5 books. He's a member of both the New Mexico Optometric Association and the American Optometric Association. He's licensed to practice optometry in New Mexico and Hawaii. Did I say that right?
You were very close. You get a gold star. That was.
There you go.
Yeah.
All right. Well, welcome.
Thank
We're
you.
very excited to have you here today.
Okay.
We look forward to everything you have to say, and you can go ahead and begin your presentation.
Well, thank you so much for inviting me, and I've been looking forward to this. And so we're going to start off with a quote, and I want to give you my interpretation of it. You probably can have your own. We don't see things as they are. We see them as we are. And one of my intentions about this presentation today is to help you see through your eyes. And we'll get more into that, but I want you to have ownership of your eyes and vision. Now, in this next quote that I put up, the eye is the window to the soul, but it's also the mirror of the body. And today I'm going to connect the dots on how our eyes affect our metabolic and endocrine health, and I'll get into that in a few minutes. The title of my presentation is called The Eyes Never Lie, What Your Vision Reveals About Your Health. And in the upper left corner is something called Functional Vision Integrative Body, and that's the method that I'm using now to teach practitioners all the things I've learned. I've been at this for about 40 years, and we started a practitioner's training last year that's actually open to non-eye doctors. There's a way that people can use this method and they don't have to be eye doctors, and they can really help their clients. And in the lower right corner is me reading one of my books, my latest book, Vital Vision, and I'll talk about my books at the end of the lecture today. But I thought I would start off about the question that I get a lot, and that is, how did I get into this? How did I get into this optometry specialty? Well, it started when I was about 8 years old. I was diagnosed with a learning disability, and my parents took me to a lot of different professionals. You know, I grew up in a family that really stressed reading and intellectual thinking, and I couldn't read. I didn't know how to read. So we ended up, after visiting several different professionals, at an ophthalmologist's office. And I got a pair of nearsighted glasses, and I became a memorizer in school. That's how I got through school. I got really good grades. I worked really hard. And every couple of years, my myopia got worse. I had progressive myopia. And I got to the point where I couldn't see the big E on the eye chart. And I was really dependent on my lenses. Well, after I graduated optometry school, I met a developmental optometrist. His name was Dr. Albert A. Shankman, and he practiced in Connecticut. I was living in Philadelphia at the time. So I started to go to him as a patient, and he said 2 things to me. He said, number one, I think your myopia, your progressive myopia, is due to tension that you've been carrying in your eyes since you've been a child. I'd never heard that before, even in optometry school. And then the second thing he said is that your left eye wanders out and you're not using your 2 eyes together. That's why you see double, and that's why you have poor reading comprehension. So I began working with Dr. Shankman in a process called physical therapy for vision. And About 6 months later, I woke up. I was rushing to my office in Philadelphia, and I'm driving on the freeway, and I'm going, oh my God, I forgot to put my contact lenses in, and I can see the road signs. I couldn't believe it. It was really a shocking moment, but it was amazing. It was an amazing healing. And I had been reducing my prescription, but this was amazing to be able to see clearly without my lenses. And we fast forward 40 years later, and I don't wear any lenses for distance or reading. So I experienced a shift in being able to completely reverse my progressive myopia. The second thing that happened to me was that I began to use my two eyes together, and I stopped seeing double vision, and I became a voracious reader. So with those two things impacting me, in my practice that I opened up, and I actually affiliated with another developmental optometrist, his name is Dr. Ellis Edelman in Philadelphia, I started a practice where I was very inspired to help people improve their vision. But the problem was, I was in an area that was very allopathically centered. A lot of ophthalmology hospitals and clinics around our office, and I couldn't get any patients. It was very frustrating. So one day I went to one of the hospitals nearby, and I met with the physiatrist and the physical therapist, and I said, I know how to do this rehabilitative optometry physical therapy on your patients. Could I come and try for 3 months and see if I can make any, improvements? So of course, after a month, these people who were suffering double vision, vertigo and balance issues, focus and concentration issues, these are people with traumatic brain injury, stroke, brain insults, all kinds of things. They were going back to their life in a normal manner. So I began then working at another couple of hospitals around Philadelphia, and that's how I built up my practice. The second thing I did at that time is I began to work with special needs kids. These were kids in the spectrum disorders, Down syndrome, minimal brain dysfunction, and I had a very strong impact on them, and I really helped them. So going after those two population groups, I built up a successful practice, which I sold about 5 years later, and I moved to my present home, Santa Fe, New Mexico, and I opened up a holistic integrative practice and, never looked back. I'm very successful at it. So that's my beginning, and now I want to bring you into what is exactly that I do. So before we get to that, I want to give a disclaimer that the information I'm sharing today is only educational, that this is not a substitute for medical care. It's not a substitute for your eye physician. This is just education, okay? And so I am not diagnosing or treating in this. I'm only sharing information. I want to give a shout out to my mentors and my teachers. I have several of them in optometry and also in the world of body-centered healing, also in nutrition, craniosacral therapy, aromatherapy, and iridology. So really grateful that I had these people really touch me, and I wouldn't be here today without them. So I'm sure all of you have been to the eye doctor, and this is an optometrist, and he has a machine in front of the patient's eyes. It's called a phoropter. And you probably have been in this situation where your optometrist will put you in front of this and say, okay, which lens is clear, 1 or 2? And you go, can you show me that again? And he says, 1 or 2, and you go, I think number 2, no, number 1, I think number 1. They're so close. So the optometrist will probably say, well, let me show you 3 and 4. This is number 3, this is number 4. 4, I think 4. And the optometrist may say, well, you're pretty definitive there. He says, well, I think I really screwed up because I still messed up because of number 1. And so this goes back and forth. And let's say you're having a stressful day and you choose a lens. And then the next thing is you get the prescription and you go back to the doctor and you say, hey doc, I'm kind of seeing out of a fishbowl. And he says, oh, that's normal. You'll just get used to it. And actually in 6 months, you'll come back and we'll make the prescription stronger and no problem. Or the other thing is you get the glasses or the contacts and you go, why is the world slanted? And the optometrist will say, well, that's just your astigmatism. Just tilt your head a little bit. You'll get used to it. And, in 6 months, you're going to get a cataract anyway. No worries. Well, no, we don't want to adjust and get used to something that's creating some kind of disharmony in us. And this is how the eye exams regularly go. So in mainstream eye care, it is dominated by reactive, symptom-based experiences. I'm sure many of you have had that. You have go in with the symptom and you leave and maybe the symptom's a little better, but you're not really getting to the root cause. And usually, whether it's farsightedness or nearsightedness, myopia, hyperopia, astigmatism, cataracts, macular degeneration, dry eye, we're going to get into all those today. Eye care is very reactive and they're going for the first line of defense. Okay, how do we control the symptom? They may manage the symptoms through prescription lenses, which, by the way, when you do get a prescription lens and you see 20/20 out of it, invariably it's probably going to weaken your eyes. And, in my practice, what we do is we figure out perhaps giving you a full prescription, but then we might give you a vision improvement prescription that you can work with in a non-demanding and non-threatening situation. And over time, your eyes can flex into the weaker prescription. It happens all the time for us. Also in mainstream eye care, basically it's pharmaceuticals, needles, surgery, and one of the big money makers today, if you have wet macular degeneration as an example, is the shots of Avastin, the anti-VEGF, and we'll go into some of those things. What are alternatives to getting the injections month after month? I've had a lot of patients over the years that have been doing those injections for a long time, and they'll come to see me, and within 3 to 6 months, using my method, they're able to completely get off the need for injections and their eyes get better. They return to health. Obviously, surgical interventions are very common, and sometimes you do need surgery. I'm not against cataract surgery. It's actually, one of the safest surgeries out there. But there might be alternatives that you can do that instead of doing surgery. So we'll go into that. The other thing that mainstream eye care does is it treats the eye as a mechanical structure, and it often ignores the deeper connections to the brain, to our systemic health, our trauma, lifestyle, and stress. One of the things that I did after I had my experience working in the hospitals is I published an article on research on the relationship between traumatic brain injury and vision. And by the way, if you want any of the citations that I shared today, I'd be happy to send you the article. My hair is a little less gray, but otherwise it is me. And I would say the case histories that I shared were really compelling, and it made a big difference in terms of bringing traumatic brain injury into the conversation around vision. So what is the science of holistic optometry? Well, there is definitely peer-reviewed literature in vision science. The Journal of Behavioral Optometry, Optometry and Vision Development have published many articles on case histories and outcome-based reports on things like visual processing problems, convergence insufficiency, which is an issue with coordinating your eyes together. It's what I had. So what is holistic optometry? Well, it considers the whole person. In this conference, and I've been listening and watching some of the other practitioners, they're all talking about, we're treating the whole person. We're reminding patients that were already whole, and instead of treating fragments, we're treating the whole person. So in vision science, in our holistic optometry approach, I'm looking at things like behavioral neuroscience. We're going to do an exercise a little later in this presentation on how to increase our neuroplasticity. And because the eyes originate from the brain, the eyes are the only part of the brain that sit outside the cranial vault. But the eyes do come from the brain very early on in utero. So when we start applying new stimulations to the eyes, we can make changes. And some of those changes can really affect our behavior. That's why there's a term that's sometimes used in holistic optometry called behavioral optometry. And that means that if we change the way we're seeing, we might change the way we respond to ourselves and the world. And we'll talk a little more about that. Another thing that I do in holistic optometry is something called somatic movement, body movement. Well, we don't just see with our eyes. Our eyes are actually our GPS system that guide our body through space. And our peripheral vision, our depth perception, all of those skills that interface with the brain get stimulated through movement. And so movement and vision work hand in hand with each other. I don't think I have to say much about nutrition. I mean, in this conference, everybody's talking about eating, in a healthier way. And certainly if we change our diet, if we eat more antioxidants, the eyes have one of the highest metabolic needs of the body. And so if we give it healthy, clean food, non-GMO, organic, we prepare it well, that's going to improve our eyesight, no question about it. Stress management is another thing. So how many people here spend more than 1 hour a day on a computer? That in itself, being on digital devices, creates a lot of stress in our eyes and in our body. So what can we do to reduce the stress, to de-stress our vision so that we're not behind the 8 ball in terms of oxidative stress, inflammation, and this creates the deterioration. You're in for a treat today because we're going to talk about light and color therapy, and I've set it up so we're actually going to all get a light and color therapy treatment. So that's going to come towards the end of my presentation, so stay tuned for that. And then finally, visual processing and integration therapies. I do this a lot with children. I'm in the process of directing and producing a new documentary that's going to be coming out this summer. And it's my work with the spectrum disorder kids that I've been, helping for over 40 years. And so, get on my email list because this documentary is really fabulous. And I've been working on it a long time. We're kind of in the final stages of it. But I want to bring awareness to the general public that vision and learning and the brain are very interrelated, and it can really affect our learning and processing of information. All right, some other things that affect our vision. I referred at the beginning of my presentation, astigmatism. And astigmatism means there's a twist in the body, a twist in the eyes, and this creates an imbalance in our posture. It's interesting with astigmatism. I'm a craniosacral therapist, and when I used to have my main office, I used to have my eye exam equipment, and right next to that I'd have my massage table. So I would measure somebody's prescription, and then I would ask them to go on the massage table, and I would do an hour of craniosacral therapy on them. Then I'd put them back in the eye exam, and I would redo the exam, and invariably their eye prescription was at least 30 to 40% less after doing an hour of craniosacral therapy. And that's what I would prescribe, and people were thrilled. They loved that prescription. So the point of it is that what prescriptions we have in our eyes can really impact our neck, our head, our body, our spine, our sacrum. And if we give a lens that's too strong, I'm telling you that the cervical spine, the thoracic, the sacrum, the pelvis is all going to feel it. And I've had a number of cranial osteopaths that refer patients to me because they say, you know, this guy's prescription is way too strong. I can feel it in his cranial rhythm. This happens over and over again. So posture, the body, how we hold ourselves, based on what prescription we're wearing in our eyes, it's going to affect our posture. What about emotions? Is there any relationship between emotions and how we see? Well, with 40 years of patients telling me this, so this is coming from patients, they'll say something like, my nearsightedness, my myopia is related to fear. And I'll then talk to farsighted people, hyperopia, and they'll say, my main emotion is anger. So if we relate that to Chinese medicine, what is fear is in the kidneys, and anger is in the liver. I'm going to talk about the liver-kidney relationship in a little bit. So our emotional body definitely has effect on our physical vision. And once you start uncovering what's behind your eyes, what's been internalized, those things are going to start to come out, and you can have emotional, psychological, even spiritual insights that can actually clear up your physical seeing. I talked a little bit about learning. So we know that, you know, when you go to the regular eye doctor and he or she has you read the distance eye chart, that's actually not vision. That's your eyesight, it's eyeballs, it's glasses. Vision is how the eyes and the brain and the body work together. So the more seamless you have that eye-brain-body connection, that's going to improve your learning. I mean, I experienced it firsthand. I was a terrible reader for 20 years, and when I met Dr. Shankman and I went through his vision therapy program and I healed my visual coordination problem, no problem in reading. I can read and write, and so it was a real epiphany in me, and again, over the years, helping thousands of kids regain their vision, which really impacts their learning. And then finally, the nervous system regulation. So our eyes reflect our sympathetic nervous system and our parasympathetic nervous system. So how does that work? So we have something in our eyes called our pupil, and the pupil is, I call it the light gatekeeper. Like, for example, you go outside and your pupils should get small. They should constrict because you want to protect yourself from the light. You don't want to have light sensitivity. Like you come inside and the pupils dilate because you need more light. Okay, so that's a nervous system, autonomic nervous system response. When you have too much sympathetic nervous system in your vision, guess what happens? Your pupils are dilated all the time. So you've got light sensitivity, you're sensitive to glare, you get eye strain, eye fatigue. Another thing you do is you tunnel your vision. This is the start of myopia. So your nervous system is a reflection of how your visual system is working and how you're working. You can't really separate it out. All right, a little more on research, because people like that. And again, I can send you citations on the science of holistic optometry. The Journal of Behavioral Optometry has reported, improvements in convergence insufficiency by doing something called the Convergence Insufficiency Symptom Survey. They also do something else called developmental eye movement test. And eye movements are very important in terms of our reading, our tracking. And so there are physical kind of standardized tests that you can do to measure the effects of the physical therapy. And not only are you seeing subjective changes, but you're also seeing objective changes. Now, what about vision mirroring stress? I talked a bit about stress and stress management. There are scientific findings out there that the sympathetic nervous system is in overdrive, and just like I talked about, we go in our fight, flight, freeze response. This increases pupil size. If we're in chronic stress, it's going to affect our accommodation, which is our focusing muscles. Our vergence is our coordination. And the other thing that we measure is the relationship between visual stress and cortisol levels. We're not surprised by that. So we go into adrenal fatigue, and I'll kind of bring those things together a little later. How does vision mirror trauma? Well, in some of the scientific reports, early trauma can lead to disorganized visual processing. So this would be birth trauma. And any kind of C-section or breech or forceps delivery will affect something called primitive reflex retention. So now we're kind of in the world of occupational therapy and physical therapy. And I had the good fortune with one of my mentors, Dr. Albert A. Sutton, who was a world-renowned developmental optometrist. He brought a group of optometrists from Scandinavia, and they taught us the primitive reflex integration therapy. So the primitive reflexes are early movement patterns that start in utero, and they kind of set the stage for the infant, toddler, child to move through these primitive patterns, movement patterns, and then the brain gets freed up where they learn how to hop and skip and jump rope, and then eventually they're tracking their eyes, they have visual coordination, and then finally they move into executive functioning processing where they make decisions and they plan ahead, stuff they do in school. But what we learned was these school-age children that have learning problems, it was because they didn't integrate their primitive reflexes. This is what these optometrists from Scandinavia taught us. So what we found is that if there was early trauma, could have been in utero, could have been at birth, could have been at the bonding period, these primitive reflexes got stuck, and they're controlled by the reptilian brain, our survival brain. It's our survival response. And so by doing this primitive reflex therapy on them, it released the brainstem, they integrated the primitive reflexes, then they could then move to the higher brain centers, and this actually had an effect on their processing. So it's a long answer to, it's one way that you can heal trauma. Probably another way you can heal trauma that I use in my practice, especially with the kids, is craniosacral therapy. I feel that craniosacral combined with primitive reflexes is a really great foundation for helping children heal trauma. And I would say craniosacral works on the fluid body and primitive reflexes work on the nervous system. Now the fluid body comes way before the nervous system. So, in a lot of rehab, they're talking about just primitive reflexes. They just stay in the nervous system. So in my practitioner training, as an example, we go all the way back to the fluid body, the cerebral spinal fluid, the fascia, the connective tissue, the lymph. Because if we can go all the way back, then we can reprogram the fluid body, and then we can do the primitive reflexes on the nervous system, and there you go. You're covering all the bases. This also can be with adults. This is what I saw in the hospitals, PTSD and trauma survivors. I've worked with a lot of veterans, and in veterans, as you probably know, there's a lot of PTSD. And the thing about our vision is because it's soft tissue, we absorb the traumas, but we can't see them on the MRIs. We can't see them on the scans. But where I do see them is functionally, symptomatically. And so by doing, again, physical vision therapy, this is a way that you can start healing the PTSD and the trauma. Some other things that happen in trauma around vision is we tend to tunnel our peripheral vision. We have trouble with eye contact. We have trouble with convergence. That's where our eyes aiming in towards each other, and focusing issues. And also the last thing is we're sensitive to light, and there's a problem with our balance, our orientation. We might have vertigo. That's that vestibular visual mismatch. What about vision and inflammation? I'll tell you, a lot of the eye diseases I see are really related to inflammation gone amok. And if you look at conditions like dry eye, uveitis, macular degeneration, just to name a few, there's a connection between those and cytokine cascades. Also, oxidative stress impairing the lens health, so that's why we develop cataracts, or retinal problems, either macular degeneration, diabetic retinopathy, or other very weird retinopathy conditions. There is a very strong gut-eye axis. I know that can be hard for some of my colleagues to understand, but the gut and the eye are very, very related and connected. So in my functional integrative my functional vision integrative body method, what I'm here to say is that functional means how we are using our visual system, as opposed to just looking at it from a structural point of view. You know, when I was in school, I learned the structure of all the anatomy. And actually, in a few minutes, I'm going to give you a functional anatomy session, just to teach you a little bit about function as opposed to just structure. There's also, in my experience, a neuroemotional and a somatic approach. When we start adding those things to our vision, it allows us to open the door to create and treat the root causes, not the symptoms. And I would say most eye care is really interested in symptom suppression. They're not really looking at the root causes. So I think of it as education, prevention, and restoration, empowering people to take agency in their healing. And this is what our practitioners training is about. Okay, so I'm going to bring you into structural anatomy versus functional anatomy. And structural anatomy focuses on form and shape. This is the lens. This is the eyelids. This is the optic nerve. Okay, so there's an identification of here's the anatomical parts, and maybe this is where the disease is. This is where the disease begins. It could be in the optic nerve, it's glaucoma. It could be in the macula, it's macular degeneration. In functional anatomy, what we're interested in is how the anatomy moves, how it works. It's more of a dynamic situation. In this particular saying that I use, function affects structure. So how we use something is going to eventually affect the anatomy. As an example, a lot of people out there go into what we call invisible bifocals or progressive lenses. And when you wear a progressive lens, what happens is basically the edges of the lens are not usable, and the only part of the lens that you can see through is the middle part, and it's split up. It's a gradient where the very top fourth of the lens is for distance, the middle part of the compartment is for computer, and the bottom part is for reading. And let's say you now have been diagnosed with macular degeneration. This happens a lot in our practice. So they come to see me, they've got macular degeneration, and they're wearing the progressive lenses. They don't like them, but they were prescribed for them. And what the progressive lenses are doing functionally is they're making the person focus and use primarily their macula exclusively. So they're making them use the weak part of their retina, but they're not even thinking, the practitioners that are prescribing these aren't even thinking of the functional ramifications. They're thinking of it as, this is cosmetically great, nobody's going to see the line, you know, everything's in one lens. And, you know, so they're not really looking at the root cause, they're just trying to treat, you know, the symptom again. So we take them out of the progressive lenses. We might give them a single vision lens for driving and a single vision lens for the computer, and maybe we give them a reading lens as well. Okay, they can still use their progressive lenses if they're really shifting back and forth. But the key thing on function affecting structure, the bigger the window you look through, the more of the eye you're using. The smaller the window you're using, the less of the eye you're using, and you're putting stress, maximum stress on the stress point. It's the weakest part of the person's retina, which is the macular degeneration. So you have to look at what are you giving the patient as it relates to their functional vision experience. Okay, so here's the anatomy of the eye. And if we go over here, see my arrow, this is the front part of the eye. We have the front part, which is the eyelids, which protect the eyes and they house the glands. So people that have things like blepharitis or meibomian gland dysfunction, their eyelids are swollen. There's inflammation going on. And so, that's going to impede their ability to produce the proper tears that then cover the clear window of the eye, which is the cornea. And so the cornea has a lot of nerve endings on it, and if it's not getting lubricated every time you blink, it feels like you've got sand in your eyes. Well, the standard approach would be to use, an immune suppressant eye drop called Restasis, which is very expensive. It suppresses your immune system. It gives you some temporary relief, but it's certainly not dealing with the cause of why the person is getting dry eye, just as an example. And then we go behind that and we see the iris, which is the colored part of the eye. And then here's a healthy lens. So I read a statistic recently that by the age of 70, 95% of people are going to get cataracts. Okay, why is that? Why do we get cataracts? Well, partly it's because the lens of the eye has no blood vessels that run through it. You don't see any blood vessels here. It's what we call an avascular structure. And it's very susceptible to oxidative stress accumulation, protein accumulation, something called the glycation process, where glucose molecules attach to the protein molecules, and this creates the cloudiness in the lens. So what can you do to reverse cataracts or slow down cataracts? Well, two of the main ingredients are glutathione and vitamin C, just to start with. We'll get into some other things, but basically if you're developing cataracts, you're low in glutathione, you're low in vitamin C, and the third thing is you need to really monitor your pancreas health and your glucose levels. Because if your glucose levels are moderate to high, if you eat a lot of carbs and a lot of white foods or sugars or bad fats, you're going to start getting oxidative stress in the lens of the eye. So there are things that you can do nutritionally to start to reverse that, and we'll talk a little more about that. If we look back here, this is called the posterior chamber. This is where we get those bothersome floaters, eye floaters. I probably get a question a day on social media, how do I fix my floaters? And we think that floaters is just an eye problem, but actually there's a systemic and metabolic cause to floaters. Anything from inflammation in the eye, liver congestion, poor dentistry, head trauma, just to name a few. And so there's some things that you can do to mitigate some of the floaters. I think improving the lymphatic system is another way. Getting better circulation in the eye sometimes is a way to get rid of the floaters. And then finally, we're back at the retina, and the retina is made up of photoreceptors. We have the macula, we have which is right here, the fovea, and then we have the retina itself, and then we have the optic nerve here, and this is the connector back to the brain. So the eye in general needs a lot of nutrients. And after about age 35 or 40, we get less and less of those nutrients into that eye area unless we have really good digestion. And coupled with stress, poor lifestyle, lots of digital use, not getting enough morning sunlight. I mean, there's a lot of reasons why our eyes let us down. And there is a genetic component to it as well. So we'll kind of go into that maybe in about 5 minutes. We'll go into that. All right, so common eye conditions. I had progressive myopia and I was able to reverse it. Certainly myopia is running in epidemic proportions because of all the screen time we're doing. I call it visual confinement time.